Hello, everyone. Welcome back to another exciting episode of Mind Your Body and Soul, the healthiest podcast you have ever heard. Remember, this is season 3. We've made it all the way to season 3, and we have a lot of great treats for you because the goal is to improve as we move along, as we go forward on our journey. So here we are showing you our improvements and how we are going to continue to give you healthcare information that you may or may not have access to. Remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about health topics and information they may or may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Remember, Mind Your Body and Soul is available every Wednesday on our website at www.nmcpodcast.com, as well as our parent website at www.neighborhoodmedicalcenter.org. We're also available on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course, our YouTube channel here. Please subscribe to this channel, like this video, comment, and subscribe, because I guarantee you, this is going to be a great one. A lot of good information. You're going to want to get your pen and pad out because it's happening today. So our guest today, I'm excited about our guest today. Matthias, are you excited?
I'm excited, Joe. It's a great opportunity to see the bridge between two organizations that always work together in the community and collaborate, but we always never see the people at the top. We always see the people working, and so we get the chance to see, the people who's running all, the people whose minds, the masterminds are behind the scenes that are working, and we just do the work. So it's a great opportunity for us to see, the great CEOs from the different organizations that come out and actually talk to us. So I'm really excited.
Look, like we say, when we talked about starting this podcast, we talked about starting this podcast for days like this. So our guest has received her medical degree from Meharry Medical College in Nashville, Tennessee, and where she was a United Methodist scholar. She completed her residency in internal medicine at the University of South Carolina in Columbia, South Carolina, receiving the Golden Hands Award, in which recognizes bedside manner and infection control. After residency, she entered solo practice and served as the chief of staff and director of the medical intensive care unit for 10 years at the Lake City Community Hospital in Lake City, Columbia. Dr. Robinson relocated to Florida and practiced internal medicine in Gadsden County for 3 years, serving predominantly the underserved prior to coming to Bond Community Health Center. Dr. Robinson served as the Chief Medical Officer of the Bond Community Health Center Incorporated from 2003 to 2014 and was appointed Chief Executive Officer in 2015. With over 30 years of successful experience in private and public healthcare, she is a fervent advocate and care for the undeserved and underrepresented. Dr. Robinson is respected nationally and locally as an effective community health leader and ambassador for the community health center movement. Her clinical leadership has assured Bond Community Health Center sure footing as it enters into its new realm of healthcare. So I want everybody in podcast land to put your hands together for Dr. Temple Robinson. Yes, ma'am. Thank you.
Good morning. Good morning.
Good morning. It's definitely a pleasure and an honor to have you on our podcast.
Well, I was just excited to get the invitation. Didn't know what we were going to talk about. And hopefully I'll have something to add to the conversation here. Can you hear me well?
Yes, we can.
Yes, ma'am.
Very good. Very good.
Yes,
and,
ma'am.
Your CEO and me, we take offense to you don't ever see us on the ground. We're always on the ground with you. Now, your viewers may not recognize that we're the CEO because we're in the trenches with our team. And we're so proud of what our team does. We try to lead by example. Some generals lead from the front, some lead from the back, some are right in the mix. And I think that Ms. Janae Freeman and myself, we do a little bit of all of it. We have to look at each situation individually and see what is best at that time. And sometimes that means gloving up and giving out vaccinations ourselves, moving tables. And sometimes it means truly suiting up and working the back end, trying to make sure that we're secure with funding, with policy, with the government, with leaders, and with stakeholders. So
Yes.
I will say that what makes us, and I'm gonna say this before I forget, though I shouldn't, what makes us good CEOs and strong CEOs is that we have a great staff and a strong team that if need be, we can turn our back and do something else and know that the job is going to get done.
Yes.
So before I say anything else, I just want to thank you all for this invitation. Thank you all for the partnership and the camaraderie that your organization has shown our organization, especially over these past 18 months. It's more than 18 months now, as we have worked together to fight this COVID vaccine, to fight the misinformation that's out there, to fight the vaccine hesitancy, to fight, remember, the crazy rumors that Black folk couldn't even get COVID.
Right.
So I'm taking you way back.
Right. To the beginning.
So I just want you to, if you can save this podcast for anybody who has ever questioned whether bond and neighborhood work together, you need to save this forever and ever. Amen. Because this is another example of the true truth.
Yes, ma'am. And I want to say on top of that, for those who don't know, let's, like we setting the record straight, neighborhood and bond, we've been in the trenches working together for the longest. We've had great relationships for the longest. So put all the myths to bed, because, and also for yourself and our CEO, like you said, when we're out in the public, they're there. All right. They are there out in the trenches with us, making sure that the services get provided to the people. So all the myths are being put to bed, because we appreciate the type of leadership that you bring, because for a lot of us to be able to see you out there with us, it makes a world of a difference. Thank you.
So let's get started. What's up today, gentlemen?
Yes, ma'am.
It's great. It's great.
Say, Matthias.
I'm ready for the first question. So can you give us some background information about Dr. Robinson and what inspired you to be a doctor, become a doctor?
Ooh, now you're going way back. You know what? I heard my computer ping. Let me see. I hope I don't lose. I don't think I will. Y'all still there? Hey,
yeah.
Okay. Yeah, I don't want to hear that computer pinging while we're trying to talk.
Okay.
So you're going far back, but I would tell you that medicine and being a pilot are the only two things I truly can remember just really wanting to do. Now, I have never become a pilot, and maybe that time will come at some time. I don't know. When I was a little kid, I used to watch Jacques Cousteau and thought I wanted to be an oceanographer. And I think I just wanted to be that because it was a long word and I could pronounce it, and I thought it was pretty cool. And I like to swim, and I still like to swim, but I really never really wanted to be an oceanographer. So medicine is really, I don't know when I decided I wanted to be a physician, but I do know my childhood, I was always a very inquisitive child. I didn't like a lot of foolishness as a child. And I was raised in rural South Carolina, where children didn't ask grown people questions about things when you were little. And in the rural South Carolina, when people got sick, you didn't ask a lot of questions about what was wrong with them. Did they go to the doctor? A lot of people didn't go to the doctor because there weren't a lot of Black doctors around, or they didn't have access even to the good white doctors that were there. When I say good, I mean compassionate. I don't mean well-trained.
Uh-huh.
And they essentially just died of treatable conditions, or they suffered with treatable ailments. And I remember as a child, someone died in the neighborhood, and they asked my grandfather, and my grandfather's a jokester, and I can't tell you any of his jokes on the podcast, and I can't quote him on the podcast without us. The FCC coming in might yank the podcast off. Okay. But anyway, one day this gentleman died, and someone said, well, did he have a heart attack? And my granddaddy said, blankety blank, yeah, it stopped. And that was the gist of it, yeah. No, they said, did he have heart trouble? And he said, yeah, blankety blank, it stopped. He had heart trouble. And, but they made a joke about it, but that's all they knew. And then when I was about maybe 11 or 12, a lady died in my mother's hometown. You know, you go where your mama was raised. And they came to my grandmother's house and they said, Miss So-and-so passed. And everybody was whispering and they said, what you mean she passed? What happened? And then they said, well, she had female troubles, you know, and so you didn't know as a child whether she bled to death or whether she had ovarian cancer or whether she had cervical cancer, because you didn't talk about that. You couldn't even say cervix or vagina. You couldn't say pregnant. You couldn't say anything.
Right.
And I remember being, I guess, about 12 or 13, just kind of coming into my young womanhood. And it scared me to death. She died of female trouble and nobody knew what it meant. And all they could do was have a big funeral and a big eating after the funeral, but no health literacy at all. And that irritated me as a child, that people were dying, no health literacy, nobody going to the doctor, few doctors around that cared for underserved people. And it just essentially grew in my bloodstream that this was something that I wanted to do and something that I wanted to try to change.
Okay. That I love that, because you saw an issue that was in your community, but an issue that was in the greater Black America as well. And you said, I want to help make change. I want to help make a change in my community. And you're actively doing that now.
Yes.
Ma'am. So I definitely appreciate that. That's wonderful.
That is wonderful.
So okay, so that's what inspired you. And I know we covered it a bit in the bio, but kind of take us through your matriculation through through medical school, learning how to become a doctor, and also how that helped you become the CEO at Bond.
Well, I get tired when I think about some of it, but you know, the getting through undergraduate school and medical school and residency, that's a long trek and a long haul, a lot of long hours, a lot of sleepless nights, a lot of book learning, a lot of bedside learning, and a lot of strong mentors. Everybody, though, of course, is not your friend or your mentor, and you hit roadblocks, and you had people who really tried to block your way for whatever purpose, I'm not sure. But it worked out. It worked out. And then when I finished my residency, I opened a private practice in Lake City, South Carolina, and practiced internal medicine for 10 years. And as you said, also was chief of staff of the hospital, opened the ICU there, and did some ER night call things. And then I was getting ready to turn 40, wanted to do something a little different. My son was getting ready to go into middle school, and the schools in that area weren't very strong. And so we were trying to, as a family, trying to decide, well, we're going to relocate within the state, or do we want to try something new? And I will say this, that at that time, there was a need, and there's still a need in Gadsden County for primary care physicians, and to get the hospital up and running, and so forth and so on. And someone said, well, how did you get to Florida? And my answer is always, I was tricked. Okay. But God has plans for you, and you don't know the plan. You can't figure out the route. You're like, how in the world how did I get to here? And I was on the path over here. Well, it was a very crooked, and I use that term the right way. It was a very crooked path. But it all worked out. So I went to Gadsden County, and I was there for about 2 years. Things did not work out. We had contractual issues, so forth and so on. And I left there, and they needed some help at Bond when Bond was in one of the older buildings on Orange Avenue. I worked at Bond for a few months, and things were just in a rough shape at Bond. And so I left there because I couldn't evoke change. I wanted to help move the needle forward, not just continue to do the same inefficient things that were being done.
Right.
So I left there and just went home for a while to try to pray over some things. And then I got a call back from the interim CEO at Bond saying, we really need your help, Dr. Robinson. I said, well, I can only come if I can improve and evoke change. They said, well, would you come as a chief medical officer? And I said, sure. Well, at that time, I was a medical director. So I came back to Bond, and I stayed as a CMO for 12, 13 years, working very hard. And none of us are perfect. And there's no health center, no clinic, no hospital that's perfect. And but trying to improve our services, try to improve access to care, trying to improve the patient and the staff experience so that people are happy when they come to the health center, and that the health center is not just a place that's just good enough, but that it is a warm and welcoming place for anybody. A lot of it, and also trying to change that attitude in the Leon County area, that bond or neighborhood is just for them and those over there. No, we're for everybody, because but for the grace of God, you could be working one day with insurance and not working the next day, and you don't have insurance. And we take almost all insurances. You all take almost all insurances. And but for insured people and people that can pay to come to the doctor, we can't care for those who cannot pay. So that's sort of how I got here. And then, in 2012, 2013, Bond hit this big bump in the road and lost a lot of funding, lost its federal status and so forth, went through a handful of interim CEOs. And then the board came and asked me, would I step in, coming off the floor as CMO, to be the CEO. And I've been sitting in this seat now since 2015, continuing, still trying to push that needle forward and to improve services, access, and make this a welcoming health center for people.
And Bond has been going strong ever since.
Well, thank you. We have some bad days, but we're working. We work to improve every day. We really do. And we have similar problems. We have similar staffing issues and financial issues. And a lot of people think because we're a federally qualified health center that we just got federal money, just out the yin yang. And it's not so. I tell people we got enough federal money to generate a whole bunch of paperwork and a whole bunch of headaches.
Exactly.
And your CEO and I spend a great deal of our time making sure that we have the finances that we need to support our staff, to pay them well, and to provide the services that our patients need. And it's a scratch, and it's a knife fight, but it's a friendly knife fight, if there's such a thing, for the few dollars that are in this area for nonprofits and for low-income folk who need health care.
Right.
And one thing I like that you said, Dr. Robinson, was that, we're for everybody, because a lot of people think that because we're FQHC, we don't see those people with insurance, and that we're not real doctors or real physicians or a real healthcare facility. But sometimes I try to tell people, you get better care at a FQHC than you would a private practice.
Exactly.
It's a little bit more different. You got more compassion, more respect for the patient. And that's what people don't understand. And then you're not looked at as a number sometimes.
Correct.
So I'm glad you actually said that part.
And the services that we provide, so many of the services we provide, there's nobody to bill for them. You can't bill for the transportation guy who goes and picks the patient up and is also, I call him a pseudo case manager, because my transportation person can see somebody over at the service station and say, let me go. I know Dr. So-and-so has been looking for him, and drive up to him and say, get in this van. The doc's been looking for you. Why did you miss your appointment? But those kind of services, case management, transportation, people helping you fill out forms because you can't figure out how to fill them out, helping you get on Obamacare, having pharmacy services in-house, all of those type of things. You're not going to get that at a private doctor's office because they can't, they don't have the capacity to provide that. If you're a pregnant woman and you come to an FQHC, we're walking you through the entire pregnancy and getting you linked to Healthy Start, and do you have problems smoking? Do you have problems keeping your lights on? These type of things. So it's a different experience when people come to us. And COVID, I wish we had never heard of the word.
Yes.
But COVID has shined a light on the community health centers. People are coming to us who didn't know we exist, are shocked and surprised when they see the quality of care and the breadth of services that we have. They're just coming for a COVID vaccine. But when they come, they realize, oh, this isn't the health department. This isn't the shot clinic. This isn't the VD clinic. This is a comprehensive community health center. You guys do dental? Yes. You do behavioral health? Yes. HIV services? Yes. You got real doctors here? Yes. We have a pediatrician? Yes. You know, and so COVID has really brought people to our health centers who didn't even know where the building was. And then when they come, I say, shame on me, because my job is to make sure we're out there, but shame on you because you really never cared.
Right. But, and to piggyback off of that, and I appreciate you covering the services, because that was going to be the next thing we get into, what services the bond provide. But so you were able to dispel the notion that people just go here for this one thing, maybe a STD, because we know I'm from Tallahassee, so the health department on Orange, we always say was the HIV building. The one on Old Bainbridge, we always say was the STD building, but working to dispel those myths. So how were you able to fight back against those myths as the CEO of Bond and make sure people really know what the real services Bond provide?
Well, it's very hard, and I'm still working at it every day. So that's what you talked about. What CEOs do. A lot of our time, we're out bending the will of people. We're educating. We're doing podcasts such as this. We're out talking with stakeholders. We're showing what we do. We have outreach workers like the two of you and community health workers, so that people, when we step out of the building, that our brand follows us. And so it then sparks that conversation. When our mobile unit pulls up someplace, all right, or our other support box trucks and so forth pull up someplace, it sparks that conversation. Who are they? What do they do? Oh my, you mean they have a mobile unit that has a dental chair in it and it has a primary care chair in it? So you've got to be out in the public for people to see what you do. And then you have to invite people in. So before COVID, we were inviting stakeholders, I say the word stakeholders, anybody who didn't know anything about us. We would ask people who knew about us to bring someone with them who did not know about us. And we would invite them over to actually see what we did and how we did it. And you have to sometimes do that on a one-on-one basis. Of course, we do commercials, we do talks and so forth, but it still takes a lot of convincing. And I have had to get over my little ego and not be upset when people don't know who we are and what we do. It used to irritate me, but I worked to try to dispel this word. People would say, we're going to the Bond Clinic. I'm like, there's no such thing as the Bond Clinic. I don't want to be called the Bond Clinic until we're at the level, like you say, the Mayo Clinic. Then you can call me the Bond Clinic. We're the Bond Community Health Center. And within the health center is comprised of various clinics. You may have, podiatry clinic or chiropractic clinic, all of this. So I spent a lot of time, and you'll hear me correct big wigs. No, it's not the Bond Clinic. It's the Bond Community Health Center. Yes. And I say it over and over and over again.
That's important, though. I'm with you. Bond Community Health Center, people.
And so, like, for the next question, it'll be more like, before we really get into the specifics about Bond Community Health Center, can you tell us about the history of Bond? Like, when was it founded? And can you tell us why, and about the history and why it was basically formed Bond Community Health Center?
Well, it has a great history. And this is why it's so important that we continue to do well, because of those people, those founders that started this agency back in the 80s. So Bond was started by community leaders within the Bond community proper. And it actually started in one of the offices, almost the size of a closet, in the Smith-Williams Center, where you are now.
Right.
Where you have a site now. And so it started there, and these were volunteer doctors, volunteer nurses, volunteer pharmacists who generally came after they closed their office or left work during the day. They came in the evening to see people living in this community who did not have access to primary care otherwise. And they gave up their time and they gave up their services. And eventually they were able to convince the city of Tallahassee and the county to put some funding behind this, to really expand what this, they were trying to do to serve our people on the South Side. Eventually, some federal funds got thrown at the situation, and it became a federally qualified health center. So we owe a debt to those people who started this agency and kept it going. You have people like Henry Lewis and C.E. Richardson, the Lewis Richardson building where neighborhood is sitting now, and where Bond has served in the past. And I think Dr. Richardson is still working part-time with Neighborhood Medical Center. This is letting you know that when it's in your blood, it's in your blood. So, these people gave of them their talent to help. And so we continued to keep that mission going. Our mission is to provide access to quality health care for all people in our community, not just those that don't have insurance, not just the downtrodden, but anybody that needs help. So that's how Bond got started. And then, so our offices were predominantly in the heart of the Bond community on Orange Avenue. Then we outgrew that area, and the opportunity came that we were able to get the building that we have now on South Gadsden Street. We have a small office. The pediatric office is really not a small office. Peds, and soon where the cooking school is, and soon OB will be in the other office on the corner of Palmer and Monroe. And we have some office space in the CarePoint building. It's called Bond on Magnolia, because if you know where CarePoint is, that's Magnolia Street that runs there, runs by CarePoint. And I was raised in South Carolina, so we're all just Magnolias. I said, that's a good name. We didn't want to call it Bond in CarePoint. We called it Bond on Magnolia. Doesn't that sound beautiful? So that is the name of our our site that's in Bond on Magnolia. And soon we'll be opening a dental site at Sable Palm. Now, our dental department is called the Smile Connection. So with probably mid-spring, we'll be opening the Smile Connection at Sable Palm, doing school-based health services, very similar to what you all are doing over at Ricketts, but it's mostly going to be dental. And then we have the mobile unit, of course, that we can take around everywhere.
Exactly. Yeah. It's interesting you say that. The last couple weeks ago, we were doing one of the empowerment events with Second Harvest, and we did see the Bond vehicle at Sable Palm.
Yes. So we go there now. We do dental services there every Friday for those kids. And if you know that community, the children there and a lot of the adults there, we're not seeing many adults yet, but the children there really need dental services and access to dental care. So we're going to now put 2 chairs at Sable Palm, and we have to renovate some space and so forth. But we're looking forward to doing that. Then we could take the mobile unit with the dental chair to another school or to another community.
Exactly.
And that's really important, because a lot of times the kids don't have somebody to take them to the doctor to see their needs. And for us to bring it, or you guys to bring it, because we both do the same thing, to bring it to the schools to where they're at, that's a great plus, because you don't get that at the regular doctor's office. You got to come to them. And it's like, as a single parent or something who's got multiple children, it's hard to say, hey, do I got time? But I can't take off work.
That's right.
So at least I can do everything I need, and my child can get the stuff that they need right then and there.
That's right.
And so it's a great. I'm really excited, especially if you got to
Yes.
get that at Sable Pond. I'm really excited because that's a community that does need it.
Yeah, and everybody thinks that everybody has a car. Well, everybody doesn't have a car, or you don't have a car that's running. So to be able to do that, and with dental and as with medicine, we can use like intraoral cameras, so you can do teledentistry. So let's say that just the hygienist at Sable Palm, and he or she can put the camera in the child's mouth, and I'm gonna sound like I'm old school now talking about Star Wars, and beam the picture back to the dentist here at the main site, because we have 8 operatory dental department here. But beam that picture back so that the dentist here can say, you can finish cleaning a child's teeth, but we're really going to have to do something else, or stop doing what you're doing. We need to prescribe some antibiotics, and then we can go back again. So that's going to be a big help too, because the dentist may not be able to be there all the time, but if the hygienist is there and they can share that picture in real time while the child is there, or the x-ray or so forth, that's going to be a big help.
Yes, it will. Yes, it will. Okay, so this question, because it's about balance and maintaining overall health, because we all know, working in healthcare, sometimes we might not have the best practices, but how do you find balance within your, like, that work-life balance, and make sure that you keep your health at a great level?
Yes. Well, something very interesting happened the other day. My cell phone was getting hot, and I thought that, oh, my phone's getting hot, I'm probably going to have to get a new one, because it's not one you can change your battery out. And so I spoke with someone, and they said, Doc, that phone is relatively new. The next question was, do you ever turn it off? You have to turn it off sometime for it to reboot, because you have so much, he didn't use the word noise, but so much noise running in the background that I suspect you don't need a new phone. You need to turn it off and let it reboot. And it reminds me of things that my father used to tell me. He said, you always need to check yourself, and you need to hear your own engine. And that means sometimes you've got to be in the quiet. So I like to go on something called Walkabout. I haven't been on Walkabout since COVID started. Walkabout, I go somewhere by myself. I may stay a week, I may stay 10 days. I don't take anybody with me, to check myself, to regroup. My father used to tell me, you got to turn the radio off in your car. That's the only way you can get to know how your engine is supposed to sound. So you can hear the engine of your car. You've got to quiet down somewhere. So how do you do this when you really can't do this? Many days I'll leave work and I'll tell the staff I'm going for a drive. And sometimes I'll go for a drive in the middle of the day. I may, where my office is, I may just take out, drive to St. Mark's, sit there 15 minutes. I have a little collapsible fishing rod in the trunk of my car. I'll go to St. Mark's and throw out a couple of times and get in the car and drive back. That calms me. Or I'll take the long way home sometime, just to decompress a little bit. And then some mornings I have to slow my roll in the morning and start my day a little later, because the night before was a long night, or the night coming is going to be a long night. So that's individually. The other piece is try the best you can to separate the home from the office. I used to have a lot of pictures of, my family in the office and so forth. And I said, you know what? You live here enough. You need to let your office be your office. Let it be comfortable. I have a very comfortable office, but let home be home. So you have home to go to, and let that be your refuge. And it is for me. It really is. Now I like to eat well, and I like good wine, and I like good scotch, but we won't get into all of that because that doesn't, you do too much of any of those other things, then you have another price to pay. But main thing is some quiet time and to try to be centered. That's the best you can do. And sometimes you have to realize that even though that's the best you can do, you might not be able to do it. And we have to do our jobs. Our jobs come first. We're in healthcare. Somebody gets sick and you say, well, I get off at 5 and they're still sick. It doesn't mean you get off at 5.
Exactly.
Right. Trust me, you're talking to people who know we don't get off there fast.
Right. So, we're in healthcare. So it is what it is.
Exactly.
So can you explain to us or tell us about, like, what are some of the most prevalent health disparities that your patients at Bond face, especially with COVID now, because, something that's new and we're getting a lot more different things with COVID and how people are being interacting with our interaction. But can you please tell us how Bond, like, kind of meets their needs and what are their needs?
Yeah, it's real scary and it's very taxing because it's not just one thing. So it may be, and it's almost like a song now, hypertension, diabetes, obesity, hypertension, diabetes, obesity. But it is also the mental health component of that. The drain, the anxiety, the stress is something what we call that allostatic load, when you just compounded stress on top of stress on top of stress. I'm broke, I don't have a job, I'm sick. Every place I go, they tell me go somewhere else and so forth and so on. And that weighs on a body. That kind of stress makes diabetes worse, makes obesity worse, makes other mental health problems worse, makes addiction and abuse of alcohol worse. And so, it's a heavy lift. We deal with a lot of it. And you say, how do we deal with it? Well, we have to take one thing at a time. We have to see what we can address, what the patient is ready for, because when you're talking about patient-centered care, it's not what I come in and say you need. Yes, there's certain things I'm going to tell you need. If you got a fever and you got pneumonia, you need antibiotics. But when we have a whole list of things, then we've got to get now the patient's perspective. Where do you want to start? And where can we guide you in this step? So you can't lose weight, stop drinking, and change your lifestyle all at one time. You got to pick one.
Right.
You got to pick one, okay? And then let's start with that one. And then let me support you from the back end on the other ones, whether it's with education, whether it's medication, whether it's with transportation. But let's pick one, because you can't change them all at one time. So there's not one big health disparity. I think the biggest health disparity, people don't realize it, is poverty. That to me is a disparity within itself. So you talked about being at the second harvest situation, the second harvest event. We're having those events for a reason. People can't buy groceries.
Right.
Okay. Or they can't buy the right groceries, or they can't mix the groceries up. So I think poverty is the biggest thing that we're dealing with.
Yeah. And we see that, I think, in any organization, no matter what it is. So with that being said, what advice as a healthcare provider would you provide to patients to ensure the best possible care is given? How can you give that as being, say not only the CEO, but also being a provider itself?
Ask your question again.
What advice would you give as a healthcare provider to patients to ensure that their best possible care is given? So basically just, because you going from both avenues. You're coming from administrative and you're coming from healthcare. So you see both sides.
Right.
So
well, I think the best thing that any patient can do is to have a relationship with your healthcare provider, so that you can communicate clearly. When you go in, you're asking the right questions, whether you have to write it down on a piece of paper or not, and that you understand when you leave that visit, that you understand clearly what the next steps are. What is the plan? Do you understand? Going back to that health literacy thing again now, not big words, but do you understand what's wrong with you if there's something wrong, and why you should take this medicine or this treatment, or why we're on this plan? And I think communication is the biggest thing. And fit. You've got to have the right fit. So neighborhood has multiple providers, some with the same specialty, because everybody doesn't click with everyone. So you don't just run off from the health center if you're not clicking with Dr. So-and-so. You might need to work with nurse practitioner so-and-so, or it may not be the physician, but we may need that case manager to come in between there. Communication. Don't just come in and have something done to you. Have that conversation with your healthcare provider. So when you leave, you're an active participant in your own healthcare. That's the way to get the best healthcare. And if you are one that's nervous or shy or don't have health literacy or not comfortable speaking for yourself at the doctor's office, take an advocate with you so that when you leave, there is some understanding of what the next steps are.
That's
key.
Excellent. Yes, excellent advice. And the reason why we're so adamant about that is because we see so many patients who really don't know how to advocate for themselves, really don't know how to get the services they need. And we do our best to get the information across, to give them the resources and to be there for them. But at the end of the day, the patient still has that responsibility for themselves. So we want to make sure that they can make the best of their healthcare.
Yes.
Yes, ma'am. So Dr. Robinson, somebody see this interview, they're going to say she is a great communicator. Oprah, somebody see this interview, hopefully, and they want to interview you. How could people get in contact with you?
Oh, very easily. You can email me at trobinson@bondchc.com. You can go to our website, and I don't know all of let me see if I can find all of these things. I have somebody to do this for me now because I'm busy. We got something called Snapchat, Chap, Lap. No, I'm just joking. So we have a Twitter account that's at @bond_CHC. And we have an Instagram account at @bond_CHC. And then there's a Facebook thing at @bondCHC Tally, TALLY. Okay. And of course, you can call the office, and my extension is 207. I'm not going to give you my cell phone number, or they can call you and you can call me.
There you go. We got it. We relay the message. Yes, ma'am. Dr. Robinson, we greatly appreciate you because, like I said, we know you're a very busy person and you do a lot and you're very important to our community. But we wanted to make this interview happen because we want to make sure that more people who may not even know about bond or clear up the misconceptions about bond, that people can get the real deal about bond, because we know what you guys do and we appreciate what you do for our community. You've been holding it down for the longest. We want to make sure we give you your flowers.
Well, thank you. This has been wonderful. I am so proud that you all invited me. I'm excited about the podcast. It's been going on for a couple of years now.
Yes, ma'am.
And it's just so refreshing and it's so much fun. So congratulations again to you. Keep up the good work.
Thank you.
Call me if you need me.
Yes, ma'am. Yes, ma'am.
Take care now.
We'll talk to you later.
All right. Make it look good now. Put the nice foggy lens on, everything you're supposed to slender out the face, all of that, all the wrinkles off the neck, make the bags off the eyes go away. Y'all got that?
We got
all my secrets on national TV. There you go.
We don't need to do much, but
on the internet. Thank you all. Take care.
Thank you.
Bye-bye.
Bye.
Yes, yes. So look, like I don't even mic drop. Look, Dr. Temple Robinson, man. Mic drop. She came in, she gave you the real, she did a great job, she gave great information. And once again, showing that Bond Community Health Center and Neighborhood Medical Center, we cousins, so we work together.
That's
So,
right.
so anytime you need help, you can either go to Bond or Neighborhood, and we're gonna make sure we take care of you. So, that's how we do it, man. Matthias, this is I feel good. I want to dance.
Good. It's a real good one because it shows, what I'm saying, it does show the collaboration between the organizations as well as it, what I'm saying, even though, what I'm saying, you might not see the CEOs, but they're regular people just like us. They're out there working. They don't act like they're a CEO sometimes. They are just normal people. And it's not somebody that, you get some CEOs that you think, oh, they're just so high-minded. They just do this, do that. Our CEOs don't do that. They actually out there with us working.
Right. That's what I'm saying. When we're out 7 in the morning or 9 at night, they're with us. When it's cold, they're with us. When it's hot,
raining. Look,
our shoes
in the rain.
Muddy. So, I mean, like I say, I'll run through a wall for anybody who I see will make sure that we got what we need to be successful. So that's how it goes. Man, look, season 3, Mind Your Body and Soul. It ain't gonna do nothing but get better from here. So you might as well subscribe. If you haven't subscribed to this YouTube channel. Like, comment, share this video, right? We're on Anchor, Breaker, Radio Republic, Pocket Cast, Spotify, Google Podcasts, as well as this YouTube channel. Remember, every Wednesday, www.nmcpodcast.com or neighborhoodmedicalcenter.org is our parent website. Make sure you go check out Bond at bondcommunityhealthcenter.com. Man, we're just out here doing what we do, having fun, making sure our community is in better shape than it was when we found it. So here we are.
Not only do they need to like it, they need to tell somebody that's going to tell somebody that's going to tell somebody. We need some followers, people. We need some more people to come in to see this. Now, it's not just for, we not just doing this just to do it. We here to educate y'all. So we need y'all to get more people to come follow us. Like, tell somebody, say, hey, we got these 2 crazy guys that's out here actually doing something. Like, follow us, like us, come speak to us. Like, we here. So we really want y'all to do that.
Neighborhood Medical Center on all platforms, IG, Facebook, YouTube, Neighborhood Medical Center. Follow us, subscribe. There's nothing but greatness coming from here. He's Matthias Sweet. I'm Joseph Ward. And is Miss Brown in there? She still there?
Yes, she is.
Tell her come people ahead.
Come on over here, Miss Brown, real quick. We got to introduce you real quick.
Ooh, shoot. Hey. So
you gotta lean for there you go.
Come forward. Yeah. All right. So America, this is our new case manager, Miss Kara Brown. Hey, Miss Brown, how you doing?
Hello.
Hey, look, I love her already. I'm her other son already. So get used to seeing this face because we are going to have a podcast. We bring Miss Brown on. We talk and the 3 of us get talking and we're going to do some things. We want to introduce her to the world. And this is another addition to our team, and we're going out making sure that we make our community a better place. So this is how we do it. Yeah. Jealous. Oh, they jealous.
Jealous, Joe. They jealous.
And Miss Brown on the same podcast. They jealous.
They jealous, Joe.
Hey, man, we love you all, and we'll see you all next week. Peace out, people.
All right.
Yep.